Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside. And now, your host and the director of the University of Kansas Cancer Center, Dr. Roy Jensen.
Good morning. I'm Dr. Shrikant Anant, filling in for Dr. Roy Jensen. And with me is Dr. Daniel Aries, who's a dermatologist at the University of Kansas Health System, and Tim Grimes, who's a melanoma cancer survivor. Welcome. Today, we are discussing skin cancer and melanoma. 1 in 5 Americans will develop skin cancer in his or her lifetime, and an estimated 91,000 new cases of melanoma will be diagnosed in 2018. The rate of melanoma has been rising for the last 30 years. As few as 5 sunburns will double a person's risk of developing melanoma, which is an increasing cause of cancer death in young Americans. So let me start with Dr. Aries. Can you please tell us what are the signs and symptoms of skin cancer?
Sure. It's a good question, particularly for melanomas. There are a couple of big things we talk about. One of them is the ABCDs, looking for a lesion that is asymmetric. So instead of being nice having the same sides, one side looks different from the other. B is border. So instead of having a nice round border, it might have like a funny scalloped or fusiform border. C is color. You like to see a mole have one color, maybe 2. When you start to get to 3 colors, a mole that has an area that's red and brown and maybe some black, that's very concerning. D is diameter. And they say that a mole bigger than 6 millimeters, or about a pencil eraser, that's of concern. And a final factor there is change. And another way of looking that's actually even more sensitive is the so-called ugly duckling sign, which is just what it sounds like. So someone has 20 moles and they all look about the same, and then number 21 looks different. Different color, different shape. That's the one to focus on.
So do you actually get that 21st mole? You talked about now that number 21. Would that 21st mole come up suddenly, or is it an evolution of that 21st mole?
It's a great question. About 2/3 of melanomas arise de novo, from scratch, from normal skin. And the other third come from a pre-existing mole. So either one could be dangerous. If there's a mole that's changing, that's concerning. If there's a brand new mole and it's looking funny, different from the other ones, that's also concerning.
So Dr. Aries, we talk about skin cancer, we talk about melanoma. How does one progress from skin cancer to melanoma?
Okay, well, it's a great question. There are a few skin cancers that we see pretty commonly in the U.S. The most common is basal cell cancer, then squamous cell cancer, which can be deadly, and then the least common of those 3 is melanoma. Melanoma is by far the deadliest. As you were saying, 10,000 Americans a year are dying of melanoma. I think they say it's 1 per hour.
Yeah.
And the rates are going up, up, up. So even though it's relatively rare among skin cancers, it's still a common and frankly preventable cause of death.
Thank you. So let me ask you a question, Tim. You're a survivor. Can you share with us how you discovered you had melanoma?
Yeah, I was actually going through the checklist in my head, and the mole that actually was concerning and ended up being melanoma definitely had all of those symptoms that he mentioned, or traits that he mentioned. I had moles removed when I was younger. Dermatologists would want to keep an eye on them or remove them in biopsy. So I was always kind of just like, they're just moles. But this one in particular was pointed out on my back, and like I said, it had all of those, traits. Kept an eye on it for about a year. Unfortunately, I took my time in getting it checked out, and it definitely got worse. So I just went in and got it removed and biopsied, and it came back about a week later that it was a higher stage of melanoma, and I should go see an oncologist. So like I said, I was definitely one of those that just didn't really worry about it because I had moles removed when I was younger and didn't realize, how much it could, how bad it could get, how serious it could get.
So what do you do about preventing recurrence of melanoma for you now?
Right now, I definitely am a lot more active in putting on sunscreen. Even my friends are good about reminding me, and just kind of covering up more a
And do you
little
do
bit.
it all year round, during summer, or just all year round?
I am not a very good skin cancer patient in the fact that I probably don't do it as often as I should, but I'm definitely more aware of it now. So yeah, I mean, I would say more likely to put sunscreen on in the summer, but there are definitely times when I kind of have to remember that, you know, even though it's cloudy, you can still get a sunburn and stuff like that. So I am definitely a little bit more, you know, cautious, but not as cautious as I should be. So don't get mad.
So if you're just joining us, we're talking about skin cancer and melanoma and the importance of early detection. Alicia Miller is here in the studio to take your questions. Remember to share this link with the people you think might benefit from our discussion. Use the hashtag BenchToBedside. Dr. Aries, can I ask you a question? Can we talk about advances that are taking place in terms of prevention and treatment of melanoma as well as skin cancer? We talked about sunscreen. What else?
Okay, well, those are two separate areas, and they're both great. So on the prevention side, there are a lot of very practical things that people can do in their own lives. And I think you mentioned sunburns as being a major factor, that 5 sunburns can double your risk. Sunscreen certainly helps. One thing that's important with sunburns is to recognize there's a difference between sun and sunburns. Sun is fine. Mm-hmm. If you're not the kind of person that turns bright pink and peels after walking the dog, walk the dog, not a problem. Go have fun, play in the park. The key is when there's a risk of burning, when it's all day at the pool, when it's the kind of day where you're going to get a lot of glare, that's when it's really important to be very sun smart, have your sunscreen on, probably even seek out shelter and shade if that's an option, and avoid those burns. Because sun exposure by itself doesn't cause skin cancer. Sunburns do.
I see. I believe we have a question. Alicia?
We do. We have 4 questions, actually. First one is there a genetic link to skin cancer or melanoma?
Fantastic question. Is there a genetic link?
Yeah, and there absolutely is, and there's probably more than one genetic link. So there are some so-called cancer genes that can increase risk of various cancers, like breast cancer and melanoma can go together, thyroid cancer and melanoma can go together. So there are, in fact, genetic markers, and that's one of the reasons why having melanoma or really any skin cancer in the family is a sign that someone needs to be a little bit more careful. Now, it's not a death sentence. It doesn't say give up hope. In fact, it says the opposite. It says, fine, there's a genetic predisposition, there's an increased risk, but that's the reason to be very smart about it.
Yeah.
And to really look out for those sunburns, avoid tanning. Women under 30 are 6 times more likely to get melanoma if they've ever done indoor tanning.
So let me ask you a question about relatives of a patient who's had melanoma. Do they just go talk to their physicians, their primary care, and tell them, hey, I do have a family member, a very close, a brother, sister, mother, father, who's had this, and so should you just let them know so they keep an eye out for this? Is that the way to get going?
I think that's a great way to start. Talk to your primary provider and say, you know, look, I just found out my mom got diagnosed with melanoma, my sister got diagnosed with melanoma. I think I'm at higher risk. And you want a good skin exam. If there's anything concerning, I think it's worthwhile to seek out an expert.
Yeah.
Go ahead and go to a dermatology office and get looked at.
Tim, has your family members done this? Is that something that has been practiced in your family?
Absolutely, yeah. It's definitely something that has made it, you know, it was not anything we worried about before, but now I think
you recognize it.
Yeah, everybody's kind of keeping an eye on it. And as Dr. Aries said, I think if it's anything concerning, people should get it checked out. I get pictures of moles from my friend. I'm like, hey, should I get this checked out? And for me, it's always like, if you're worried, yes, go.
I do want to come back to asking you about your clinical trial,
Sure.
but Alicia has another question. Can you tell us the next question?
Yes, the next question is, are spray sunscreens safe to use on children? What are the most important things to look for in terms of finding safe, effective sunscreens to use on children?
Children and sunscreen.
Okay. Again, another wonderful question. So I want to take this again, and it's a multi-part answer to a pretty simple question. The first thing is the best sunscreen is the one you'll actually use. So I don't want to say, oh, sprays aren't that good, don't use any sunscreen. That said, I would say sprays are not that good. The coverage is poor. It can go into the eyes and the mouth and other places it really doesn't belong. The best sunscreens for children, and really the best sunscreens for anyone, are sunscreens that contain ingredients like zinc and titanium. Zinc is not only a really excellent protector, it's a little layer of metal between you and the burning rays, but it's also very safe. It's a nutrient. If you look at certain vitamin pills, you'll see zinc is something we all need. By the same token, I recommend lip blockers if your kids will tolerate them, because sunburns on the lips happen and are very dangerous as well.
Yes.
Some ways more dangerous. So, am I allowed to mention product, or is that not a good idea?
Not a good idea.
I won't mention product. I'll tell you guys, go out there, go on the internet, find products that contain zinc.
That's right.
And the other nice thing about zinc is it lasts longer. And some of the chemicals, in fact, can degrade into byproducts that make the sun more dangerous. So again, zinc sunscreen, and the other thing to add to that, maybe you didn't ask for all this, but the other thing to add to that is hats are wonderful. Not so much for kids, but for anyone who will wear them, sunglasses are great too. So hats, sunglasses, lip block, and a zinc sunscreen, and your dermatologist will bless that particular approach.
Thank you. Alicia, next question?
Yes, the next question is there an age range that is at higher risk?
Another excellent question. So the answer is younger. Sunburns early in life are especially dangerous. In fact, sunburns before age 15 are considered to be far more dangerous than sunburns after age 15. So I'm not saying, oh, you're 17, go out and burn. I'm not saying that. But I am saying to parents especially, when your kids are smaller, they're at much higher risk. So it's really, really important to get that sunscreen on them if they're at risk of burning it. This doesn't apply to everyday life. If they're going to go out and play at recess and they're not going to get a burn, if they're not that red-haired child who's going to burn every time and they're fine going in the sun, they can go in the sun.
Yeah.
But you're taking that trip south, you're going to Texas, pack the sunscreen.
Thank you. Alicia?
Here's one more question. I've heard that melanomas can often appear in areas that aren't even exposed to the sun. Can you explain why or how that happens?
Okay, another really interesting question, and this does have a practical application as well. So, most melanomas, 85%, are considered to be ultraviolet radiation induced, meaning sunburn accounts for 85% of melanomas, or indoor tanning. The other 15%, it's something else that causes that, and it may just be random. A fair amount of cancers are random, or so-called stochastic, which is a fancy way of saying random. So the other 15%, they can occur anywhere. And that's why if you're changing a kid's diaper and you see a really weird looking mole, it's something that's worth checking out.
Yeah.
And the same applies to individuals who maybe are not red-haired and not fair-skinned and think, oh, I won't get a melanoma, I can't burn, look at my wonderful darker skin. They can still get melanomas, often what are called acrolentiginous melanomas, meaning on the hands, on the feet. In our clinic, we found a melanoma on the foot of a lady in her 50s who came in for a harmless spot in her arm, and we said, should we look at you since you're here?
Yeah.
And she had a blueberry on her foot and didn't think anything of it because there was no skin cancer in her family, but in fact it was a melanoma, and it was successfully removed.
So Tim, I want to really get back to the clinical trials and your experience with the clinical trial.
Yeah, I mean, when I was first diagnosed, my chances were not good. I wasn't given a very good prognosis, so it was definitely, let's do whatever we can and be aggressive. So I started on a clinical trial. I have ended up doing different drugs since then, but I was excited to be a part of the clinical trial just because I know how important they are in advancing treatments. So, even if it didn't work for me, I was excited to be able to help, future patients or at least help the study of it. But I did end up doing about 5 different treatments, and a lot of them are right fresh off the clinical trial phase. So that meant a lot to me for people that went through it. I actually know a couple of people who were on my drugs in the clinical trial phase. So just for them to go through it and kind of take that risk, it's definitely not as I guess not as safe or as studied as something that's not in clinical trials. So, for people to go through that and be able to help advance the medicine, that was something that I really liked hearing about, and to be able to be a part of that was definitely exciting as well. Like I said, because a lot of the drugs that saved my life ended up, they were fresh off clinical trials. So it's definitely important to get involved.
So let me ask you this question, because when you are faced with this choice that you have to go to a clinical trial, did it really worry you that you had to go into clinical trial on a drug that you didn't really know how safe it was?
Not really.
Did you ask the doctor a lot of questions?
I did, yeah. He definitely put me at ease, and you know, he made everything very clear, and you know, was answered all my questions, and that was definitely important. I you know, as much as I was ready to take it on, you know, and be aggressive, you know, I obviously still had concerns, but he put me at ease, and even one of the drugs I was on, I had a bad reaction to, but he was able to get it under control and
Fantastic.
you know, kind of sidestep that and get back on the right path. So yeah, I mean, it was definitely kind of an easy choice once I looked at, you know, the other choices and was explained how everything worked. It was for me kind of a no-brainer.
And it was not just a physician, right? So you had the support staff as well in the hospital who were also
Absolutely, yeah.
And you had constant communications with them, so you were never ever felt like you were left alone after being given the drug?
Oh, absolutely, yeah. No, they checked up on me all the time. You know, I think I had probably close to weekly visits, just monitoring my blood levels and things like that.
Fantastic.
And I think the way that my oncologist heard about it was through another cancer center. So he was kind of working with some other people outside of his hospital as well. So that was nice because there was definitely different eyes, you know, on my status and keeping an eye on me.
Thank you so much for sharing that
Sure.
experience. Alicia, another question?
Yes, Dr. Aries mentioned that tanning beds are not safe and that sunburns are what causes skin cancer. If an individual does not burn from a tanning bed, are they still okay to use?
That's an excellent question, and it raises a really good point that these are statistics, and so they're kind of looking at groups. And if there is an individual person who is tanning in a really, really mild way, let's say, you know, just a minute, 2-3 times a week. So their goal is not really to make their skin tone change. They're not trying to get dark. They're doing it for another reason. For instance, we have patients for whom we recommend tanning for things like psoriasis or certain kinds of lymphoma. But they're not really doing it with the goal of changing their appearance. They're doing it with a very different goal of controlling a symptom where ultraviolet light in a very low dose will help. Now, the thing is that the kids, and it's mostly kids who are doing the tanning, most of them don't really have a real mature approach, and many of them are doing it instead to change their skin. And the dermatology view of this is all skin is beautiful. Love the skin you're in. If you're pale, be pale.
Yeah.
Don't try to make yourself into someone you're not, because that tends to be unsafe.
And you also mentioned that melanoma is a bigger problem in children, younger ages, right?
That's correct. It's that early exposure. So, you know, maybe a 16-year-old thinks, oh, I won't burn. I'll just walk that fine line between making myself a little bit darker and not ever burning. But if they fail, they step off that line once or twice or 5 times, they've doubled their lifetime risk of melanoma. So they've doubled their risk of a deadly skin cancer for the purpose of something cosmetic.
Yeah, it's really not worth it.
No.
Yeah. Alicia?
There's another question here. Should individuals see a dermatologist annually for a mole check?
Again, a really good question. There's a lot of controversy around it. Someone who has never had sunburns, there's no skin cancer in the family, there's probably not a reason to get an annual check from a dermatologist. It's good enough just to talk to the doctor about it during an annual physical, and also maybe do a self-exam, and I tend to say 4 times a year, because that'll tell you things are changing. It's kind of like puppies. If you look at your puppy every day, you don't notice your puppy's gotten bigger. If you look, let's say, you know, Christmas, St. Patrick's Day, July 4th, and Halloween, that's 4 times a year, and you'll notice, hey, that puppy got bigger. And so I think that is worthwhile for everyone. Just do a skin check for yourself. But people who are at risk, someone who's had a melanoma, yeah, they need to be followed. Someone who's had some sunburns and maybe has a grandmother who's had a basal cell cancer, that person needs to be looked at.
But then you generally start with the primary care physician anyway,
Correct.
and then they will refer you to a dermatologist.
That's correct.
And then they will decide whether you need to do it every year.
That's correct.
Or not, right? So,
That's correct.
Alicia?
Are self-tanning products such as lotion safe?
Okay, the answer on that is they generally are safe. The self-tanners are the right way to go about it. If you want to change your look for some reason or other and you want to make your skin a little darker, use a self-tanner. In terms of the spray-on self-tanners, I'd be careful not to breathe it, because the things that make the skin darker bind to proteins called keratins. Don't worry, this will be over quick. The lung has the same kind of proteins, so you don't want to be tanning the inside of your lung. So hold your breath if you're going to spray it on. If you're just rubbing it on, that's fine.
Thank you. Tim, so you've gone through your clinical trial, and you finished your clinical trial. Since then, what kind of care are you getting, and do you need it? And
yeah, I actually was able to stop treatment in January. I had my last treatment, which was definitely a big milestone. Not only was I cancer-free after a long battle, but I was under the impression I'd have to do some type of treatment the rest of my life. So that was a big milestone for me. But yeah, now it's just kind of every 3 months ish, I go in and make sure it's still not coming back, hasn't spread anymore, anything like that, and also skin checks. And I've definitely overall been more aware of my health, trying to eat better. Definitely, like I said, I slack a little bit on the sun protection, but it's definitely more than it would have been a couple of years ago. So yeah, I mean, I think I try to take a healthier approach to my life in general, and that was definitely a big eye opener for me. It was just a lot of little things that you can do throughout your routine can make a big difference in the long run too.
I guess after hearing Dr. Aries today, you're going to definitely be using more sunscreen on a regular basis.
I don't want to get in trouble, that's
since you don't even have hair.
Oh yeah, no, this thing has been burnt many times, that's for sure. It sneaks up on you when you don't have any hair.
That's true. If you're just joining us, we're talking with Dr. Daniel Aries, who's a dermatologist, about the importance of early detection with skin cancer, and a melanoma survivor, Tim Grimes, who's been telling us all his stories about how he's gone through it. Alicia Miller is here in the studio to take any questions. Any final questions, Alicia?
There are no final questions, but we will be continuing the conversation on Facebook, so if you still have questions, let us know and we will get those answered for you.
Thank you, Tim. Thank you, Dr. Aries. Let's give them a big hand for helping us think through the skin cancer and melanoma. Join us next Wednesday at 10 a.m. for Bench to Bedside as we discuss what patients should know about advances in radiation therapy. Thank you for watching, and we will see you next Wednesday at 10 a.m. Thank you.